diverse flora, particularly medicinal plant which hold immense significance in traditional healthcare practices. The study explored the ethnobotanical knowledge associated with medicinal plant in Gujarat, aiming to document indigenous practices and assess conservation strategies to safeguard these valuable resources. Through field survey and interview with local communities, health and practitioners, research identify key medicinal plant species, their use and the traditional method of collection. The finding aim to contribute to sustainable development initiatives and promote awareness of the critical needs to promote Gujarat medicinal plant heritage. I identify Asia director indica, the plant of family Miliaceae, Ocimum sanctum, Terminalia arjuna, etc. The plants used and find during the field survey. Okay.
Namaste to all. I, Dr. Gunmala Gugalia. Congratulations to Dr. Arjun Dave sir and Vedant Knowledge System for organizing such a wonderful event to celebrate Viksit Bharat at 2047. It's an honor to chair a session during this conference. It's a pleasure to through the paper presented by Rajjo Singh and Falisa Parmar, Department of Botany, Monarch University, Ahmedabad. The title was Integrating Traditional Knowledge with the Conservation, a study of medicinal plant in Gujarat state. This paper is explored the ethnobotanical knowledge associated with the medicinal plant in Gujarat. Through field study and interviews with local communities, healers and practitioners, the researchers find key medicinal plant species like neem, tulsi, arjun, ashwagandha, their uses, collection and applications. This study also evaluated the conservation studies of the medicinal plants by sustainable harvesting techniques. I wish good luck to presenter for the study and journey toward the excellence. I am grateful to Dr. Arjun Dave and Team Vedant for giving me a chance with connect to you all. Best wishes for the conference and thanks.
Namaste and warm greetings to everyone. It is my honor to welcome you all to the India's biggest virtual conference on Sustainable Development Goals 2030, a platform where thought leaders, policy makers and change makers come together to drive meaningful action for Viksit Bharat by 2047. As we move forward, bridging the gaps in education, healthcare, clean energy and sustainable innovation, it is imperative that we focus on collaborative solutions, technological advancements and policy-driven impact to accelerate India's progress towards a greener, more inclusive and resilient future. This session will bring forth transformative ideas, groundbreaking research and actionable strategies to address key sustainability challenges. Let's engage, inspire and work collectively towards a prosperous, self-reliant and sustainable India. I look forward to insightful discussions and impactful takeaways from this conference. Let's build the future together. This is Dr. Sumitha, Associate Professor from JBAS College in Chennai with 24 years of higher education experience with a PhD in microbial biotechnology. I worked on microbial decaffeination. And I look forward again to insightful discussions and impactful takeaways from this conference. Thank you.
Hello everyone, my name is Dr. Kulsoom Bano and an assistant professor in the Department of Medical Laboratory Techniques, Era University, Lucknow. First of all, I just want to thank the Vedant Knowledge System for providing me an opportunity to represent my research in the multidisciplinary conference on sustainable development goals 2030, bridging gaps and building a future for Viksit Bharat 2047. The core area of my research work is on the biodegradable plastics. The title of the work I am going to represent here is the extracellular PHB depolymerase from Pseudomonas aeruginosa PHB to advancing bioremediation of biodegradable plastics. The whole study is focused on the biodegradation enzyme, biodegradable plastics, microbes secreting biodegradable enzymes, the availability of microbes present in the surrounding environment, different environmental samples, how the microbes are secreting extracellular enzyme, what is their characteristics, what the factors they are utilizing, and what are the role of the microbes in the bioremediation, in the environmental restoration. In the present scenario, the plastic degradation is basically a global issue. So we need to find out an effective way of using the biodegradable plastics, what about their degradation, and the use of the microbes for the environmental restoration, for the sustainable development in the fields of the biodegradation of the plastics. So in order to find out how the microbes are utilizing their extracellular enzymes, how the microbes are playing a major role in the bioremediation of the biodegradable plastics, we worked on the different environmental samples. The study was started with the sample collection from the different environmental samples like sewage sludge, wastewater, and the soil samples, contaminated soil samples. The different microbes was collected from different environmental samples, and the degradation study was carried out within the laboratory setups on a plate with the additional carbon source, biodegradable additional carbon source. In the presence of the additional carbon source PHB, an accurate amount of that carbon source was provided. So the microbes, among all the isolated microbes, the microbes which was showing the maximum degradation capacity was taken for further study of the for further study. So the microbes after screening the microbes that are causing the biodegradation of the plastics, the maximum degradation activity was recorded based on the enzyme assay techniques, and after that the microbes was identified based on the molecular characteristics, that is the 16S RNA sequencings. So among other microbes that were screened positive for the degradation study, Pseudomonas aeruginosa was identified based on the 16S RNA sequencing, and that microbes was utilized for the further study of the enzymes purification characteristics, enzymes optimization, how the extra enzymes, cellular enzymes, are using in the degradation of the other biodegradable plastics. And after the identification, the optimization study, that is the presence of the different environmental factor was studied, that is like nitrogen source, carbon source, and the presence of the additional carbon source, what the pH factor is required, at what maximum temperature the degradation study is maximum, all the other factors was studied. So from the findings we could suggest that the biodegradable enzymes can be used up for the biodegradation enzymes can be used up for the environmental restoration and for the restoration and controlling the biodegradable plastic waste. Thank you everyone for listening me carefully, and I would thank you everyone.
Here is a review on the paper Extracellular PHB depolymerase of Pseudomonas aeruginosa PHB2 Advancing Bioremediation of Biodegradable Plastics. This paper provides a study on the isolation, identification and optimization of polyhydroxybutyrate depolymerase from Pseudomonas aeruginosa PHB2. It highlights its potential application in plastic biodegradation. The strengths of the paper are relevance and scientific importance. The study addresses a critical global issue, plastic pollution, and its bioremediation using microbial enzymes. The focus on Pseudomonas aeruginosa (PHB2) for PHB degradation is timely, and it is highly valuable for environmental sustainability. Well-defined methodology, the screening of PHB degrading bacteria, enzyme production optimization and statistical analysis, ANOVA and hypothesis testing are systematically carried out. The use of 16S rRNA sequencing for bacterial identification strengthens the study's reliability. Statistical analysis and experimental rigor, the inclusion of ANOVA tests and hypothesis testing ensures that variability in enzyme production is statistically validated. Well-documented results with tables summarizing PHB depolymerase activity under different conditions like incubation time, temperature, nitrogen and carbon sources are well given. Comprehensive literature review. The review integrates recent findings on microbial enzyme-driven bioremediation. It also contextualizes the research within existing knowledge gaps. There are certain areas for improvement, and there are recommendations. The hypothesis testing framework is well structured, but some null hypotheses lack precise biological reasoning. Justify each hypothesis based on enzyme kinetics or microbial metabolism. That's a suggestion. And improved data presentation and clarity would be better. So some figures and tables need additional annotations. Table 1, that is on PHB degraders, should include sequence similarity confidence intervals. Figure 1, clear zone of PHB hydrolysis. It lacks a quantitative scale for comparison. Table 8, ANOVA results should mention effect size for better interpretation. Figures 2 and 3, substrate and pH effects, should include error bars for statistical significance. And discussion on environmental application and limitations. The discussion on biodegradation feasibility is limited to laboratory conditions. It is better to expand on how the enzyme might perform in real-world environments like soil, wastewater and landfill conditions. And there is a slight lack in the discussion on enzyme stability and reusability. Mention enzyme immobilization techniques to enhance its industrial applicability, and potential side effects not addressed. The ecotoxicological impact of PHB degradation products to be included will improve the paper. Mention possible byproducts and their environmental safety assessments. Expanding the discussion on future applications. The paper briefly mentions genetic engineering for enhanced PHB depolymerase activity, but no experimental insights are provided. The suggestion is to discuss possible enzyme engineering techniques like site-directed mutagenesis, directed evolution and so on. So it would improve the discussions on future applications. Integration with industrial waste management systems. While bioremediation applications are highlighted, real-world implementation challenges, cost, scalability, regulatory approvals are missing. So provide a comparative analysis of enzyme-based biodegradation versus conventional plastic disposable methods. It would be better. And there are minor sentence reformations changes. Reformation would do. Sentences like the findings highlighted here suggest that this enzyme could be employed in environmental restoration and controlling biodegradable plastic waste can be restructured for conciseness. The suggestion is to use precise language. This study suggests PHB depolymerase as a potential tool for the biodegradable plastic waste management and environmental restoration would do. And other than that, references are up to the mark. Standardized citations styles would do. So grammar and clarity, proofreading for concise and technical language and remove redundant phrasing would improve the paper. On the whole, the paper is scientifically well structured. It is strong, methodologically strong, but if it implements the suggestions given, it would be a very highly impactful paper in the present area of research. Thank you very much.
Today I am going to present a conference paper on comparative analysis of pathophysiological effects in abnormal vaginal discharge, a multidimensional approach, presented by me, Kiran Kharsodiya, PhD scholar, Department of Biosciences, Modi University of Science and Technology, Lakshmangarh, Rajasthan. So basically, we have concluded a study on abnormal vaginal discharge, which is a common clinical condition with the diverse causes, including infections, hormonal imbalances, and lifestyle factors. A study analyzed 100 high vaginal swab samples at the endocrine lab in Jodhpur to assess the microbial diversity, inflammatory biomarkers, and environmental risk factors. Pathological AVD showed overgrowth of pathogens like Gardnerella vaginalis and Candida albicans, along with high inflammation, while physiological abnormal vaginal discharge cases had balanced microbes and low inflammation. So the primary key risk factors included hygiene practices, antibiotic use, and sexual behavior. The key findings suggest personalized diagnosis and treatment are essential to overcome the woman's health outcomes. Basically, the abnormal vaginal discharge is a common and significant health concern affecting millions of women globally. So it can cause discomfort, anxiety, and impact overall well-being of females. And the condition can be triggered by infections, hormonal fluctuations, or external factors like hygiene practices. And to understand the difference between the pathological and physiological causes of AVD, it's crucial for effective diagnosis and management. The study provides a comprehensive analysis of microbial diversity, inflammatory markers, and environmental influences in AVD cases, aiming to improve clinical approaches and health outcomes for affected females. The study aims to distinguish between pathological and physiological causes of AVD by examining the microbial profiles, inflammatory biomarkers, and environmental and lifestyle factors. So we have used the methodology of sample collection. 100 high vaginal swabs were collected at the endocrine lab Jodhpur. We have differentiated into two groups. Pathological cases have found 70 cases have found pathological cause of AVD, and 30 cases have found physiological cause of AVD. So in lab analysis, we have done the microbial profiling through quantitative PCR, 16S rRNA sequencing, and we have done the biomarker analysis through ELISA technique. And for statistical analysis, we have used SPSS and ANOVA tools for statistical comparisons. Results in microbial profiles, we have found that the presence of Gardnerella vaginalis and Candida albicans is more, and in physiological causes of AVD, balanced microbial communities were found, which is more lactobacillus species. And in inflammatory biomarkers, key findings, pathological cause of AVD have found high levels of interleukins 1 beta, interleukin 6, and tumor necrosis factor alpha. Immune response activation with increased neutrophils and macrophages were found in inflammatory biomarkers. In environmental and lifestyle factors, we have done the regression test for the comparative analysis of pathophysiological effects on the basis of douching, poor hygiene, and hormonal changes are significant risk factors which we have found, and higher rates of pathological causes of AVD have found in middle income women with the specific hygiene practices. The conclusion of this study reveals that the pathological causes of AVD involves microbial overgrowth and high inflammation, while physiological AVD shows a microbial balance with a minimal inflammation. So these insights highlight the need for the personalized diagnostic approaches. We recommend incorporate routine microbiome analysis and diagnostics, educate women on hygiene and lifestyle impacts, and develop personalized treatments targeting microbial and inflammatory aspects. For clinical implications, advanced diagnostics and personalized therapies are essential to improving outcomes for women with AVD, addressing both microbial diversity and inflammation biomarkers is key to better patient care. Thank you.
Here is a review of the paper, Comparative Analysis of Pathophysiological Effects in Abnormal Vaginal Discharge, a multidimensional approach. It presents a well-structured study analyzing microbial diversity, inflammatory biomarkers, and environmental factors influencing abnormal vaginal discharge. The strengths are it has a comprehensive literature review. The introduction provides a strong foundation by citing relevant studies. It effectively highlights knowledge gaps, justifying the research. The methodology is very clear. The study design is well structured, including a sample size justification, n is equal to 100 here. The methods for microbial profiling, qPCR, culture technique, 16S RNA sequencing, and inflammatory biomarker analysis, ELISA, are appropriately chosen. Well-defined statistical analysis is taken. Statistical methods such as independent t-test, chi-square tests, Parmanova for beta diversity are correctly applied. Multivariate regression analysis is effectively used to discuss risk factors. Robust discussion and clinical relevance. The discussion effectively links findings to clinical implications. The emphasis on hygiene practices, hormonal fluctuations, and microbial dysbiosis is commendable. There are slight areas for improvement, and here are a few recommendations. The objective statement in the introduction is broad. A more precise research question would enhance clarity. The suggestion is to clearly define the primary and secondary objectives. The primary objective, it could be like this. The primary objective is to compare microbial diversity between pathological and physiological AVD cases using 16S RNA sequencing. The secondary objective is to evaluate inflammatory biomarker variations and associated environmental factors. And second, the hypothesis is not explicitly stated. Add a clear null and alternative hypothesis before the methodology section. That's my second recommendation. And my third recommendation is the standardization of terminologies and consistency in using the terms. There are inconsistencies slightly in use of terminologies. Microbial dysbiosis is sometimes equated with physiological AVD, which might be misleading. The study refers to pathological AVD but does not provide clinical diagnostic criteria, example Newgan score or Amsel's criteria. The suggestion is to define these terms explicitly and ensure consistent usage throughout the study. Figures, tables and data presentation. The paper contains useful statistical tables and figures, but some need improvements. Table 1 and Figure 1, microbial profiles. Here, the figure could benefit from statistical annotations, example, p-values for differences between groups. Include error bars and significance markers in the figure. Figure 4, correlation of douching, hygiene and AVD rates. The description lacks details on how correlation was calculated. So they must specify the statistical test, Pearson's correlation or logistic regression, whichever is used. Beta diversity, figure 6, the plot is given. No details on clustering thresholds is given there. So provide clustering significance values, that is p-values from Parmanova. It would be helpful. And additional controls and justification. There is absence of a healthy control group. The study compares pathological versus physiological AVD but lacks a healthy control group. If feasible, future studies should include a third group, healthy vaginal microbiome, for better comparative insights. Potential confounders not addressed, factors such as age, contraceptive use, and menstrual phase at the time of sampling may influence results. So, include a table listing baseline characteristics and adjust for confounders in statistical models. And expanded discussion on clinical implications. The study suggests microbiome-based diagnostics, but practical implementation challenges are not addressed. It would be better if they briefly discuss cost, accessibility, and feasibility of microbiome sequencing in routine clinical settings. And therapeutic implications. The paper hints at personalized treatments but lacks details on potential interventions. The solution is to expand discussion on probiotic therapy, antimicrobial stewardship, and hormonal interventions. That's just a suggestion. And there are minor grammatical inconsistencies. It could be overlooked. Final proofreading for grammar, conciseness, and flow will enhance the readability. Reference formatting. Some references lack DOI links and journal issue numbers. So standardize those references using the same citation style would help. The study on the whole has a very good scientific rigor. Clarity is on point, readable. Clinical relevance is very good, and statistical soundness I give 5 on 5. The paper is scientifically robust and well structured, but minor refinements as suggested would significantly enhance its impact. Very good work, and it has contributed significantly to the area of research. Thank you.
Hello everyone, my name is Supriya. I am a PhD scholar from CSIR Central Building Research Institute, Rutvi, and today I am presenting in India's biggest virtual conference on Sustainable Development Goals 2030, Bridging Futures for Viksit Bharat 2047, and I'm gonna present on low carbon cement, a solution to cut down the global CO2 emission from cement industries. As we know, cement is a basic need of a human being. Cement is the most widely used material on a global scale for infrastructure, for buildings, for construction, etc. And we are also very well known about how much CO2 the cement production can generate. Cement production or cement industries generates about 8% global CO2 emission. So this emission is continuously rising, the carbon footprint raising continuously as the cement demand is increasing and the cement production year by year increasing. So how to reduce down this carbon footprint? Because the carbon footprint causes global greenhouse gas emission or greenhouse gas effect. So how to reduce down this carbon footprint of cement? Cement industries are working on so many strategies or plans to mitigate the carbon emission of cement production. There are a lot of agencies which are working worldwide, like International Energy Agency, GCAs. They have presented several technology roadmaps to mitigate the carbon footprint of cement production, whether it is the use of less raw material for cement production, the use of low carbon fuels in place of high carbon fuels, the use of alternative fuels, we can say, the CO2 utilization in cement based materials. So there are a lot of strategies which have been already developed for mitigating the carbon emission of cement production. One of them is the development of low carbon cement and the CO2 sequestration into the cement based materials. So for this, because cement basically, if it let me introduce with cement basically produced with argillaceous and calcareous materials, which is our limestone and sand, and by mixing these two raw mixes, it fired at 1450 degrees centigrade, and via addition of gypsum, the cement, which is basically ordinary Portland cement, is produced. So for around 1 ton of OPC, it contributes almost equal CO2 emission, which is a huge amount, and that is why it generates a lot of CO2 emission. So how to reduce down this CO2 emission? There is a production of low carbon cement which have been already developed in markets, because these are low carbon cements, because they produce at low temperature by using less raw material. So it could have a big opportunity, or it has a huge opportunity to mitigate the CO2 emission. So this low carbon cement basically produced at 1250 degrees centigrade. In my research, I have developed a low lime, low carbon clinker, which we called clincarb. It is basically a carbonatable material. It is a CO2 sequestered cement basically. What happens? OPC generally sets with water and provide strength. But for this non-hydraulic low carbon cement, we cured it with carbon dioxide. We sequestered CO2 into the cement. And also it is produced at low temperature. So the work has been done for years, and we have developed this low lime, low carbon clinker cement. It is a sustainable clinker which we produce utilizing low grade limestone. Limestone is high grade, because for cement manufacturing, the cement industries required the limestone having lime content more than 50%. And the lime content below 40%, they have rejected it as a waste, as they cannot use it for cement production. But we developed this clinker by utilizing this low grade limestone, and we have developed it at 1250 degrees centigrade, which is almost 200 degrees centigrade lower temperature than the conventional cement. And we observe that this has a huge potential for CO2 emission. It almost reduces 50% of CO2 emission as compared to OPC. And the key benefits of this cement is it is significant CO2 sequestration, provides significant CO2 sequestration during the curing process, and also providing the reduction in limestone mining waste, and utilizes the existing infrastructure with minimal changes and lower energy consumption, as it is produced at low temperature, so the less fuel is used, so it also saves the energy consumption and also the waste management costs. This system is basically based on precast components. We have made blocks, panels, pavers of this, and for the its potential for large scale adoption in carbon sensitive construction sectors. We cured it with flue gas, and reduces the process emission and the fuel emission as well. So for the sustainability perspective, this clincarb provides a great opportunity for the cement industries to reduce down the carbon footprint, which is their most a huge problem of the cement industries across the world. So
This is regarding the paper which has been assigned to me for review, entitled Low Lime Non-Hydraulic Cement Solution to Curb Limestone Rejects Round the Globe, which has been authored by Supriya from CBRI. This paper, I feel, it comes under the category Waste to Wealth, since the authors have prepared clinker, that is one of the mining rejects. They have used the mining rejects to prepare a material which can be used to sequester carbon dioxide and to reduce the carbon footprint. So clinker, the main objectives of the paper, as I outlined, was the clinker material has been used to sequester carbon dioxide. It lowers the sintering temperature. They have lowered the and usage of this material. This material was prepared at a temperature, at a sintering temperature, which was 200 degrees centigrade lower than the conventional one. They have optimally designed the raw material feed before combustion in the kiln to reduce the process emission. This material, clincarb, has the potential to absorb the CO2 as it has carbonatable mineral phase, and they have utilized the rejected limestone in place of the conventional high grade limestone for the preparation of this material. And that's why I mentioned that it comes under waste to wealth. Also, the production temperature is 1250 degrees centigrade, which is 250 degrees centigrade lower than that of the typical production temperature. And they have particularly used the mining waste, is also comes under mining waste management. How they have effectively used the mining waste rejects to produce a material which can be used for that is reduction of the carbon dioxide, which is now a very important thing. That is how to stay below that. That is a 2 degrees centigrade. That's the carbon. That's carbon emission. The authors have they have used the characterization techniques for the material. They have used field emission scanning electron microscope, thermal gravimetry analysis (FTIR), XRD, and compressive strength development of carbonated limestone mining rejects based clinker cement tube systems at various duration of carbon dioxide curing. And also they have gone for that is the digital car that is they have also gone for carbon dioxide footprint reduction potential. So I will that is the each of the characterization techniques. What are the that is the highlights of each of the characterization techniques? I'll read out. For in the field emission scanning electron microscope, the finding of the author was they have noticed the formation of heterogeneous morphologies across the clinker grades and particle size and shape varying by the grade. In the XRD, they have noticed three polymorphs, calcite, aragonite, and veterite. They were detected, and that is the carbonation of calcium and magnesium silicate phases resulted in the formation of magnesium calcite. The production of the calcite occurred at higher concentration, and that is why they have a major effect on the extent of carbonation. And it was difficult to detect in XRD analysis too. It showed similar 2 theta values with calcite and was hard to be distinguished. Calcium and magnesium silicate minerals. What are the findings in this? Calcium and magnesium silicate minerals are non-hydraulic. Water is just a medium in the carbonation reaction to transfer the CO2 without its consumption by the phases. In thermal gravimetry analysis, the authors have detected the amount of CO2 absorbed by the carbonated clinker cement samples after CO2 using two major peaks ranging between 400 to 550 degrees centigrade and from 600 to 800 degrees centigrade they were detected, and their subsequent decomposition of magnesium carbonate and calcium carbonate respectively. In the FTIR, that is, the presence of calcium and magnesium silicates were detected. The compressive strength development, the calcite and the magnesium carbonate are responsible for the strength development of the carbonated samples. And in the last, that is in the reduction that is in the carbon footprint reduction potential, which the authors gave through a bar chart, it showed that there was a that is a 50% reduction in the carbon dioxide footprint based on the various grades of clinker that they have used. And that is why, since they have shown a 50% reduction in the 50% reduction in the carbon dioxide footprint, this is a very good initiative taken towards the minimization of the carbon footprint. And one of my suggestions would be that is we can even further reduce this it can be more than 50%. In order to go beyond the 50% that is percentage, I would suggest the authors to try a kind of hybrid composite that is apart from taking the mining rejects, why they can at least put some filler materials, the brick clay, the fire clay, which are also the rejects. They can use those as filler materials in order to bring down that percentage, even that is around 75 to 80%. So that would be my suggestion to them. That is making a hybrid material or making a composite material, and then study the effect on the carbon, that reduction in the carbon footprint. It's a very nice paper, and I would like to congratulate the authors because of the great initiative they have taken, and all the best for their very bright future. Thank you.
Hello everyone, myself Dr. Madhavi Tiwari Pandey from Department of Applied Science, Shri Rawatpur Sarkar University, Raipur, Chhattisgarh. And today I feel honored to be a part of India's biggest virtual conference of Sustainable Development Goals 2020, Bridging Gaps, Building Futures for Viksit Bharat at the rate 2047. And it is my privilege to chair this session and contribute to discussions which is going to shape the future of sustainable development. Now I would like to share with you all some kind of my expertise which aligns this present conference. So I am having expertise in sustainable technology, bioremediation, biodegradation, biotechnology, environmental science, and my work here completely aligns with the conference vision of creating a sustainable and prosperous India by 2047. Now I would like to give some kind of relevancy to the conference theme. So as we move forward towards achieving the UN's Sustainable Development Goals by 2030, it is crucial for us to bridge gaps in innovation, policy and implementation, because the research which is going to present today in this conference will play a vital role in addressing challenges like climate resilience, renewable energy, sustainable agriculture, environmental pollution, conservation of environment and public health. And now I would like to share some kind of my personal insights and innovations towards this conference, which is that in order to build a Viksit Bharat by 2047, we must embrace some kind of scientific innovations, achievements, interdisciplinary collaborations and policy attainments. And whether it is through clean technologies, green chemistry or sustainable resource management, every small step will bring us closer to resilient and self-resilient India. Now I look forward through this conference, I look forward to some kind of insightful discussions, groundbreaking research and innovative solutions that will emerge from this conference. So now let's work together to build a sustainable, inclusive and technological advanced future for India. So thank you, and let's have an inspiring session now. Thank you.
Hello everyone, my name is Bhanderi Rutvi, B.Pharm 8th semester at my University, Rajkot, Gujarat. I am presenting review on combination therapy and microneedling technologies emerging advances for the treatment of androgenetic alopecia, guided by Ms. Ayushi Agrawal Bansal, Assistant Professor at my University, Rajkot, Gujarat. First of all, I would like to ask, what is AGA? AGA is androgenetic alopecia, which means it is a kind of a disorder where the hair loss take place. It impacts over the 50% of the individual suffers with AGA, negatively influence psychological health. Limitation of conventional therapies, oral finasteride and topical minoxidil, FDA approved, but have less effectiveness, uneven outcomes and possible adverse effects. Advancement is novel approaches that enhance medication absorption and target follicle regeneration, including microneedling, PRP and transdermal administration devices like copper zinc microneedle CAP. With that, results of combination treatments such as PRP and minoxidil are better than those of the monotherapies. Start with the combination therapies. First, PRP, the platelet-rich plasma, and minoxidil. PRP individually by supplying growth factors that encourages tissue remodeling, angiogenesis, and hair follicle proliferation. It stimulates the growth of the hair, natural hair, stimulates follicles and increases their density. Research indicates that after 3 months, the treatment area has grown an average of 33.6% new hairs. Limitation is expensive, requires several sessions, and yields inconsistent result, particularly in more complex cases. Minoxidil, it individually extends the anaphase phase, improves blood supply to the hair follicles. 2% often used by women and 5% by male. A topical solution are available twice daily. Application results in significant regrowth. Limitation is unwanted hair growth, irritation of the scalp, reversibility of the result upon the stopping use. Next is combining them enhances the hair density, diameter, and regeneration through complementary mechanism, which better results than the monotherapies available. Here are the shown outcomes measures which they have scientists have taken, and they have given statistical data with that weight mean difference with 95% of confidential interval. Next is intradermal monotherapy combined with microneedling and sterile topical solution. Its results are amplified with a topical solution that contain Chondrus crispus extract, octapeptide 2, copper tripeptide 1, selenediol salicylate. There were no examples of blindness getting worse, and 70% of individuals experienced noticeable improvement. In terms of hair regeneration, microneedling enhances the efficacy of topical treatments and intradermotherapy. The results of microneedling alone versus when used in the conjunction with the topical treatment requires more investigation. Third is the nanocomposite microneedle patch. AGA caused by the DTH induced hair follicle shrinkage and also causes the inflammation and delayed follicle regeneration. Copper zinc dual drop mesoporous silica nanoparticles loaded with the quercetin are delivered via nanocomposite microneedle patches. Zinc 2 plus prevents the production of DTH. Cu2 plus with quercetin lowers the inflammation, encourages angiogenesis, and boosts the growth of new hair follicles. In result, ZCQ with the microneedle patch enhance the hair follicle migration, proliferation, and shift the from telogen phase, means the resting phase, to the anagen is the growing phase. In a mouse model, noticeable hair growth as a result of angiogenesis and inflammation decreases. When compared to topical treatments, control release by microneedle improved efficacy and patient compliance, although more clinical research is required. The fourth case I have included fourth case study where minoxidil dutasteroid 0.01% and microneedle dutasteride 0.001%, minoxidil 0.1% for the female pattern hair loss. Overview is female pattern hair loss involves progressive hair thinning due to prolonged telogen phase, the resting phase, and the follicle miniaturization with the diffuse thinning over the scalp but preserved frontal hairline. FDA approved minoxidil increases blood flow and stimulates hair growth. Dutasteride, a 5-alpha reductase inhibitor, is used off-label for FPHL. Microneedle enhances drug delivery and neovascularization. Study design, they have taken 40 women aged 80 to 65 with the trichoscopy, diagnosed female pattern hair loss in 2 groups. A and B protocols are 6 biweekly treatment session over 12 weeks, assessed clinically, trichoscopically, and via the patient self-evaluation. Here are the results of that. Better outcome, as you can see in the combined therapy, there is more better outcomes is seen. Clinical response is shown, and the trichoscopic find is pre and post treatment with that p values are shown. Efficacy of group A is significantly better clinical and trichoscopic improvement compared to B. Both reported reduce in hair loss and increase hair volume. Safety, mild scalp irritation in A resolving quickly. No systematic side effects or changes in blood pressure and heart rate in either group, then it is good. Fifth one is the comparison of microneedle with the platelet-rich plasma shows versus topical minoxidil plus finasteride. This combination shows faster results and the better patient compliance and early improvements in hair regeneration. Limitation is small sample size and short 6-month follow-ups. Lack of comparability in the duration of hair flow among the group is been seen. Case study, the investigation into the manufacturing and properties of minoxidil nanosuspension. Aim is to improve the solubility and dissolution of the minoxidil. Biological classification, class 2 drug using a solvent anti-solvent precipitation method. Key findings is formulation optimization, best solubility achieved with the methanol, optimal formulation with R24 sample. It is a bacterial sample. Particle size was, as you can see, 22 to 6.67 plus minus 9.32 nm. PDI is shown 0.29 plus minus 0.02. Composition is they have taken 75 mg per ml minoxidil and 0.16% sodium CMC, 5% twin 20. Process optimization, solvent to anti-solvent ratio 1:3 methanol to water. Ideal concentration 75 microgram per liter. Aggregation at the higher doses, sonication for the 10 minutes. Freeze drying impact, reduce the particle size with stable zeta potential, improved physical stability over the liquid from at 4 degrees Celsius. Drug release, they have shown freeze dried R24 biphasic release, and liquid formulation has shown faster release. Stability, freeze dried has remained stable for 8 weeks at 4 degrees Celsius. Liquid formulation showed size increase at room temperature. Conclusion, this combination significantly enhanced minoxidil's solubility, stability, and controlled release. Freeze drying further improved particle size and physical stability, highlighting the potential to enhance bioavailability of poorly soluble drugs. This is the picture where they have taken the rats and where they have used a non-treated part and the treated, and how the hair growth is taken place is shown. The other is investigation into the microneedle patch and cold atmospheric plasma. This is again an advancement. 50% of the people experience hair loss, which is made worse by aging and diseases such as AGA, which is caused by vascular degeneration surrounding the hair folds. Here, conventional, that is minoxidil, have issues with the compliance effectiveness, as I have told you earlier. Using a new multimodal platform, CAP is combined with the minoxidil loaded nanostructure lipid carriers in microneedle patch, while CAP provides a nitric oxide to widen the perifollicular arteries and increase the blood flow. As the blood flow increases, the hair growth gets better, and minoxidil improves the medication delivery to hair follicles. This method outperformed minoxidil alone in AGA murines model in terms of angiogenesis, hair follicles recovery, and the hair regrowth. Furthermore, TA capsulated dissolving microneedle outperformed TA creams and injection for alopecia areata in vivo models, showing the decreased inflammation, increased hair growth, and improve the scalp immunological repair. This address efficiency and systemic side effects and present viable substitute for the conventional one. The effectiveness of minoxidil with microneedle with the minoxidil against microneedle with hair multivitamin solution. In this study, 50 male patients with the AGA were treated with microneedling with microneedle versus minoxidil versus microneedle with a hair multivitamin solution. A minimum invasive procedure as seen by the microneedle promotes angiogenesis activities, the want beta-casein pathway, and stimulates the growth factors including the PDGF and VEGF. It's good hormone to increase the hair growth. Vasodilators, minoxidil increase blood flow and encourages hair growth. Multivitamin solution 45 follicles with minerals including daphthenol and biotin. Comparing the microneedle with multivitamin group to the microneedle plus minoxidil group, the results of that the former had better results, like 76% with a great response, and these results are consistent with earlier research showing that the minoxidil and microneedle work better together to treat the AGA. The conclusion, by improving the administration, stability, and absorption, innovative combination therapies and the cutting-edge microneedling technologies are revolutionizing the treatment of androgenetic alopecia. The dissolving microneedles, non-composite patches, and the combination of metal ions and antioxidants are examples of innovations that increases efficacy and lessen the frequency of topical application. Although preliminary results are encouraging, there are some drawbacks such as inconsistent treatment plans. As we have seen, some treatments are for lesser time, and it's like 6 months, or like they have covered study for that time period only. A lack of established procedures and the dearth of long-term data in order to determine safety, efficacy, and guidelines for broad adoption. Future research should concentrate on optimizing multi-component techniques, combining PRP and microneedling with the cutting-edge drug delivery devices, and carrying out through clinical trials. Thank you. I hope my review is fruitful.
Hello everyone, this is Dr. Madhavi Tiwari Pandey, Assistant Professor from Department of Applied Science, Shri Rawatpura Sarkar University, Raipur, Chhattisgarh. Now, first of all, I would like to give lot of thanks to the entire team of Vedant Knowledge System, and I want to give lot of congratulations and best wishes to the entire team for organizing India's biggest virtual international conference. And again, I would like to give lot of thanks to the entire team who gave me this privilege to chair this session on combination therapy and microneedling technologies, emerging advances for the treatment of androgenetic alopecia, also known as AGA, which was presented by the author Bhanderi Rutvi and Ayushi Agrawal Bansals from School of Pharmaceutical Sciences, Atmiya University, Gujarat, Rajkot, Gujarat. And this research team, both of them presented various kinds of research areas. For example, they highlighted combination therapies work better. According to them, they have presented some combination of therapies and proved them with their research that they appear to be better than any other kind of preferences. I would like to explain this, what they want to tell here. The review highlights the synergistic effects of PRP with minoxidil, showing improved hair density and follicle regeneration compared to monotherapies. So when we compare their treatment from monotherapies, this treatment proved out to be a better option. And secondly, they also emphasized on microneedling advancement. They used copper zinc dual doped microneedles and nanocomposite microneedle patches, which enhanced drug delivery, reduced inflammation, and promoted follicle regeneration. Moreover, they also highlighted the incorporation of cold atmospheric plasma and microneedle integration. And according to them, the innovative approaches like this cap assisted microneedling further improved treatment efficacy by enhancing blood circulation and follicle activation. And lastly, they have highlighted that emerging drug delivery system works better. According to them, dissolving microneedles, nanosuspensions, and transdermal patches ensure sustained drug release with fewer side effects, according to them. And their research also highlighted various kinds of clinical impact, like their innovative therapies. This type of innovative therapies which they have presented here offers personalized, more effective and long-lasting solutions for hair loss. But here I would like to suggest them that still they need to somewhat modify and to have modify such kind of protocols for standardization also. And I would like to suggest that more clinical trials are still needed to standardize protocols and establish their widespread. It's just an advice for them. Moreover, they have very nicely they have presented all their research work. And lastly, I would like to conclude that this research highlights the future of hair loss treatment, which is a shift towards more efficient, patient-friendly and technology-driven solutions. So lastly, I would like to congratulate the authors on this insightful research and look forward to further advancement in these fields. which will be a great personalized step towards the effective hair loss solution. Now, I would like to thank you all, and I hope that you all have enjoyed this session well. Thank you, everyone.
Welcome to India's biggest virtual conference on Sustainable Development Goals 2030. Hi, I'm Dr. Lubna Kamal, Associate Professor, State Jawaharlal Nehru Homeopathic Medical College, and the topic for my presentation today is Homeopathic Intervention in the Management of Chronic Kidney Disease, a Perspective Observational Study. Now, what is chronic kidney disease? It is the progressive and permanent loss of renal function for more than 3 months consecutively. The leading causes of renal failure, especially in India, is hypertension, diabetes, and indiscriminate use of medicines, especially the painkillers, antibiotics, and the steroids. There are at least 1 in 10 patients having some form of renal failure in India. While the other non-communicable diseases are decreasing in their incidence, the chronic renal failure is rising. Incidence of end-stage renal disease is approximately 260 per million population of patients each year. Now, out of these, only 6 get treated, while the rest of 254 patients are left to wait for death. Why? Because modern medicines only offer 2 solutions, the dialysis and the transplant. There is not even a single pill worldwide in modern system of medicines which can bring down the urea or the creatinine levels or improve the efficiency of kidneys even by 1%. Now, this is the vicious circle in which the patient undergoing dialysis is forever trapped, because due to intake of protein, the urea level rises, then the patient has to undergo for dialysis, then there is loss of structural protein, for which the patient has to increase the protein intake, and as a result of which the urea again rises. So this dialysis, the cycle of dialysis, it goes on and on until, of course, until homeopathy steps in. So this is how homeopathy can help the patient to bring down the urea and the creatinine levels and improve the efficiency of the kidneys. These are the results of our study in which 1,271 patients were taken up. Out of them, only 261 patients were available with proper follow-up. And out of 861 patients, 491 patients showed improvement, 200 patients maintained status quo, which is also taken as a positive sign, and 163 patients were not improving. And at Nano Homeopathy Clinic, me and my team, we have the world record of treating and successfully managing more than 20,000 patients of chronic renal failure with homeopathy. This is a 65-year-old male patient who was undergoing dialysis from September 2022 bi-weekly, and he took treatment from us for some time, and we were able to reduce his dialysis and ultimately stop it completely, and the dialysis was stopped within 4 or 5 months. He continues to be absolutely okay even till date. This is the picture of a conference in Agra where he was presented as a live case, and these are the pre-treatment and the post-treatment reports. This is a 72-year-old female patient who was having recurrent UTI, and her creatinine rose to nearly 7, where she was advised to get the fistula made and undergo dialysis. She is absolutely okay, and these are the reports of the patient. Her UTI is also okay, and her current creatinine is just around 2. She is absolutely alright. And even in this case, dialysis was not required even once. This is a 26-year-old transplant patient who underwent transplant at a private hospital in Lucknow, and soon after 6 months his kidney showed signs of rejection, and he was advised to go for dialysis and to get a new kidney for transplantation. He contacted us, and his creatinine reduced, his quality of life improved. He went back to his job in Gurgaon, and even till today he is perfectly alright without requiring another dialysis or another graft. His creatinine has decreased. These are the current reports of the patient. This is another case where the patient was advised dialysis, his creatinine was very high, 11.5. He was advised dialysis at SGPGI Lucknow, but he could not afford it. So he started taking homeopathic treatment with us, and in a year's time, his creatinine became normal, and in 15 years.
Hello everyone, and I am Dr. Madhavi Tiwari Pandey, Assistant Professor from Department of Applied Science, Shri Rawatpura Sarkar University. And I am honored to chair this session, and it is a privilege for me to introduce and review an insightful study entitled as Homeopathic Intervention in the Management of Chronic Kidney Disease, presented by Dr. Lubna Kamal and Mohan Singh. In this complete study, according to my review, I have analyzed that it is a kind of review paper they have presented here. To present such kind of review paper, a person needs to present a lot of data. He or she needs to study lot of paper to present such kind of data, comparative data, and both of these researchers have gone through lot of paper for presenting such kind of review and data in their review paper. Now I would likely want to explain the relevance and importance of the research presented by these two researchers. So this paper is generally based on the chronic kidney disease treatment process, whether it has to be done by the allopathy process or via homeopathy process, and both of the researchers have focused more on the homeopathy treatment option. So according to them, CKD, which is also known as chronic kidney disease, it is a growing global health concern. Globally, many people inside and outside India are affected by such kind of CKD. And there are a lot of conventional treatment methods for dialysis and kidney transplants. And as we all know that such kind of treatments is very costly, time taking, and many expert hands and trainees are required to have such kind of options for the treatment. So this study explores an alternative approach using homeopathic interventions. The researchers have highlighted various kinds of homeopathic interventions which, if a person uses it from the beginning, then he or she is going to avoid such kind of diseases. So the main aim of this study is to focus on alternative approach using homeopathic interventions, aiming to reduce dialysis dependency and to improve the patient outcomes. So the key findings of this research is that the study conducted over 17 years, and they have analyzed that about 1,271 CKD patients with 861 completing follow-ups. So among those patients, according to the researchers, among those patients, 58% patients showed clinical improvement, while rest of the 23 to 24 patients maintained stable disease progression. So according to the researchers, if those 24% patients would have treated with medicines like homeopathic medicines like Natrum muriaticum, Lycopodicum, Arsenicum album, they may show promising effects. According to the researchers, some patients reduce their dialysis frequency, indicating potential cost-effective supportive treatment for CKD. Now I would like to suggest some kind of implications and future directions which could help researchers for their future planning in this particular field of research. See, homeopathy may serve as a complementary therapy alongside conventional CKD treatments. You should give more clinical trials, practice more clinical trials and standardize research to validate these things, so that you can file for patents, for some kind of patents also in your research. My suggestion is that. And after this, I would like to say that the integration of homeopathy in nephrology and patient care guidelines could provide a holistic approach to managing CKD. So lastly, I would like to conclude that this research opens new dimensions in integrative nephrology, which addresses the need for sustainable, patient-friendly investigations and interventions. And lastly, I would like to congratulate both the authors for their dedication towards exploring innovative solutions in chronic disease management. And lastly, I would like to thank you all, and I look forward for an engaging session next week. Thank you. Engaging session. Thank you.
Very good morning to all. I'm Dr. K. Hima Bindu, working as professor in Andhra Medical College, Visakhapatnam, reason which comes under NTR University of Health Sciences from Andhra Pradesh. Today, my topic of presentation is how can India strengthen mental health services as part of its efforts to promote holistic well-being by 2047. So before getting into this topic, I'd just like to mention about the specific learning objectives of this session as follows. That is like a definition of health, the prevalence of mental health disorders in India, status of mental health care, and how there is shortfall of specialists and what are the factors associated with mental health, especially in India, and then steps to promote mental health and the challenge faced while following the steps, and what could be the future prospects or goals. So before going into the discussion proper, first of all, let us know what is the definition of health as per given by WHO, that is World Health Organization. It is nothing but a state of complete physical, mental, and social well-being, and not merely just the physical absence of disease and infirmity. So mental health means it includes emotional, psychological, social well-being, and overall, that means overall mental and emotional state. So it determines various factors like it determines various outputs like how the person can handle stress, interpersonal relationships, and decision making, etc., etc. So, as per the World Health Organization Global Health Report, mental illness is the leading cause of disability and ill health in the world. So approximately 1 in 4 are suffering from some or the other problem of mental illness. And estimated 15 crore of people need an active intervention. And of these, nearly 1.2 crore are living with serious mental disorders. That's why I have taken this topic for discussion. So a countrywide National Institute of Mental Health and Neurosciences, that is NIMHANS study, has shown that at least 13.7% of India's general population has been projected to be suffering from some or the other mental illness, and 10.6% require serious intervention. So it includes various conditions like most commonly depressive disorders, and then suicidal rates because of that, depression, anxiety, and all these things. The suicide rate, as per the statistics in India, has increased to 12.7% per 1 lakh in the country. So this is the statistical data that we have. And among various age group, the youth are mainly involved, which we need to tackle very intelligently. So the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being. So it should be kept as a national goal to achieve this task. So the suicide prevention has become a global priority and was included in the Sustainable Development Goals under 3.4. So for achievement of good health and well-being of the nation. So the National Institute of Mental Health and Neurosciences data that includes 80% of people, there is no access of even mental health care in our India. So it could be because of various reasons like lack of knowledge, stigma, and high cost of care, etc. So this needs to be addressed very carefully. And apart from that, there is shortfall of specialists in our country. Like as per World Health Organization, per 1 lakh population, we have psychiatrists 0.3 and nurses 0.12 and psychologists 0.07 and social workers like ASHA workers and all these people, that is 0.07. So nearly one trained psychiatrist we do have right now for every 250,000 people. And overall mental health workforce availability is less than 1 per 1 lakh population. So it is very large gap is seen. So if you look into what are the factors associated with mental health in India, especially, number one would be poverty with economic inequality, and then online and social media influences like cyberbullying and gender disparities, like women are more affected when compared to the men. And then vulnerability of adolescents, that's what we have just now discussed, that youth are more involved in this, like they are getting affected more with the various sorts of mental disorders. And then aging population and geriatric mental health, that is those people are most commonly suffering from loneliness, depression, and dementia, natural disorders and trauma like floods and earthquakes. So these are all the various factors. And apart from that, recently we have seen that COVID-19 pandemic also has influenced very badly the entire nation, making the large population getting affected with the various mental illness kinds of disorders. So this has been published in the reputed journal like Lancet. The data has been recovered from that. And then, what are the steps that we can take to promote mental health? There were, and there are global initiatives and initiatives by our government of India. Global initiatives like World Mental Health Day, 10th October, to create the general awareness, and then World Health Assembly, that is like adopted the action plan 2013 to 2020. So then Mental Health Atlas, so that is nothing but compilation of data provided by all the countries around the world. And then initiatives by Government of India are number one, National Mental Health Program. So it was adopted by the Government of India in 1982. So we have 25 centers of excellence, 19 government medical colleges or institutions to strengthen 47 PG departments in especially mental health specialities. And then district mental health programs also add to that. So national mental health programs and district mental health programs, they together constitute a comprehensive strategy for mental health care in India. Then at the primary health care level, more than 1.73 lakhs sub health centers and primary health centers to Ayushman Arogya Mandir. So it comes under Ayushman Bharat. And then online training courses were delivered by National Institute of Mental Health and Neurosciences, Bangalore, and Lokapriya Gopinath Bordoli, Regional Institute of Mental Health, Tejpur, Assam, and Central Institute of Psychiatry, Ranchi. So the total number of professional trains under these digital academies are around 42,488. And then apart from that, MPhil clinical psychology course and BSc psychology course, there was like introduction of a various number of courses were getting increased. The number of institutions and universities are also getting increased for the betterment of the healthcare in India. Then Ayushman Bharat, like health and wellness centers, so which come under a part of Ayushman Bharat program. So here the Ayush systems were introduced for a pluralistic system of integrative healthcare. So the government of India decided that 1.5 lakh health and wellness centers were introduced to deliver comprehensive primary health care. That means for aiming towards the preventive, promotive, curative, rehabilitative, and palliative care. These are all like wholesome well-being of the nation. So mental, neurological, and substance use disorders at health and wellness centers were also tackled. And apart from that, Mental Health Act, which was introduced in 2017, so which has brought on the significant reduction in the scope for the use of Section 309 IPC, which denotes the attempt to commit suicide punishable only as an exception. Then Kiran Helpline, which was introduced in 2020. So 24-hour service, online service available in 13 languages. So 660 clinical or rehabilitation psychologists were there, 668 psychiatrists as volunteers. So it is coordinated by NIEP, MD and NIM HR under the Ministry of Social Justice and Empowerment. So we do have National Tele-Mental Health Program, which was introduced in 10th October 2022 as Telemanas programs. So here 22 languages they are covering and 24-hour service toll-free with the toll-free helpline number. So with this we have developed 53 Telemana cells which have covered 15,95,000 calls till now. Then Manas mobile app also. So on the phone itself, the patients can approach the volunteers, health volunteers. So that is mental health and normal augmentation system. So it is endorsed by as a national program by the Prime Minister's Science, Technology and Innovation Advisory Council. Then Manodarpan initiative, which is an initiative of the Ministry of Education aimed at to provide psychosocial support to students, family members, and teachers as well. Especially, it was aimed during the times of COVID-19 pandemic. Then Rashtriya Kishore Swasthya Karyakram. So it is also aiming especially towards the adolescent persons because the mental illness are more common in that age group. So it includes both in the patients like adolescents which were suffering in urban and rural areas, girls and boys, and married and unmarried, and whether they are studying or not out of school also. And it includes lesbian, gay, bisexual, transgender, and queer group also. So it is it works in collaboration with the United Nations Population Fund. So that is it has developed a national adolescent health strategy. Then comes Yuva Spandana Yojana from Karnataka. So it is a youth policy initiative. So bringing up Yuva Spandana Kendra, many centers, youth response centers. The National Institute of Mental Health and Neurosciences, NIMHANS, so that we have already discussed, and NIMHANS and I Got Diksha collaboration platforms are also available. So finally, we address the pandemic-induced mental health challenges. 24-hour online service is available, and financial support for mental health institutions were also initiated by the Government of India. So fund allocation of 159.75 crores for states or union territories under the National Health Mission has been initiated in 2022 and 23. So then coming to what are the challenges faced during this, following the steps to promote mental health are high public health burden. So 150 million people were suffering from that. And then demographic dividend and loss to economy because of the mental illness, and then rise in severity because of the economic drop down. Then the important thing, which is not the least criteria, that is the social stigma in our country and lack of awareness and education, and then prone to abuse. Then lack of mental health infrastructure because we have 0.75 psychiatrists per 1 lakh population, and while the desirable number is 3 psychiatrists per 1 lakh population. So how can we improve the mental health? This is a very serious issue. So lack of resources like low financial resource allocation. So 93,000 crore for mental health, there is a need. So we got only 600 crore budget in 2019 and 1,000 crore budget in the latest budget. And high treatment costs, especially in the private healthcare centers, and then which has like increasing the economic loss of the patient population also. So because of that post-treatment gap is, and along with that post-treatment gap is there, only treatment was given, but there is no rehabilitation of the patients. Then urban-rural divide, because there is more possibility of approachability to the mental health services in urban areas. That is also geographical variation is there, and changes in policy implementation. That is like to improve the gap between that. So then what would be the future prospects or goals? So the need of the hour is to provoke masses to learn about mental health through campaigns like Swachh Manishka Abhiyan. So shifting to convergent model of mental health like wholesome, whole school, whole community, whole child model in the US, and then including mental health in education, public health programs, and primary health care, and also increasing mental health care infrastructure by providing training and providing more number of psychiatrists, psychologists, and counselors, and promoting telemedicine and online mental health services, and increasing awareness to the public by social media, and working on affordability aspects and covering the insurance also. So the treatment could be more affordable to all classes of people, and increasing investment in public health again. That is, the World Bank estimates that 90% of all health needs can be met at primary healthcare centers as well. Then more investments are needed for training at grassroots level by training ASHA workers, A&M, and other people. So 0.05% of its health budget only was spent by annually by India in the last few years, but approximately recently, the 2024 and 25, there was a budget of like a 2% of the total budget. So the budget is the mental health budget is approximately 1% of that. So community partnership also can be aimed at by taking the help of self-help groups and non-government organizations like Banyan, Sangat, and Center for Mental Health Law and Policy from Pune. And apart from that, we need to deliver the mental health services empathetically with sensitive, compassionate, and free from stigma and discrimination. And police sensitization also can be done for suicide, because suicide rate is also increasing in India. And learning lessons which we have learned from COVID or even HIV rates for combating these diseases, that can be implemented here as well. So recently, the editorial based on mental health of medical students can no longer be ignored was published by Indian Express in 2024. So the National Medical Commission has set up a task force to address the mental health and well-being of medical students, because they have seen that 122 students have committed suicide in the past 5 years. The medical fraternity, the student community, who are going to become the good doctors, who are going to treat the people with mental illness, they themselves are suffering because of the peer pressure or academic pressure and what may not be. So we cannot ignore even that, because we are going to produce good doctors who can participate in these mental health awareness programs and all that. So the online survey has revealed that 27.8% of undergraduate medical students have mental health issues, and 31.3% of postgraduate students have had suicidal thoughts. So this shows that mental health is a serious concern and needs a well-planned policy. So I would like to conclude my talk by saying that with our oversight programs, which were already welcomed by the Government of India, and the set future prospects to be dealt with in near future, India will definitely be strengthening the mental health services as part of its efforts to promote holistic well-being by 2047 as the Sustainable Development Goals under 3.4 for approaching the good health and well-being of the Indian population. Thank you. Thank you very much for giving me this opportunity.
Hello everyone, myself Dr. Madhavi Tiwari from Department of Applied Science, Shri Rawatpura Sarkar University, Raipur, Chhattisgarh, and I am honored to chair this session, and it is a privilege for me to introduce and review an insightful paper by Dr. K. Hima Bindu on strengthening mental health services in India as a part of the vision for Viksit Bharat at the rate 2047. And now I would like to explain that according to the researcher, why this is important. As we all know that mental health, earlier also from several years, mental health is a critical yet neglected area which needs some kind of attention to be given for emerging a healthy society as well as healthy India. Because whether it is any kind of innovation, technology, if a person involved in any kind of practices, if his or her mental health is not balanced, then nobody is going to work for innovations, technology, and for the well-being of a country. Therefore, this research conducted by Dr. K.H. Bindu was very important, and it is a critical yet neglected area according to the researcher, affecting over 150 million people in India. And according to her, with an 80% treatment gap, urgent reforms are needed to make mental health care accessible, affordable, and stigma-free. So now I would like to explain certain key highlights of this research paper. Firstly, they have focused on some kind of current challenges which this area is facing. First is the severe shortage of professionals, which is less than one psychiatrist per 1 lakh people. And second current challenge this area is generally facing is the lack of awareness and stigma, which prevent people from seeking help. Actually, what happens that stress, when we talk about stress may cause due to any kind of factor. Some people are there which doesn't want to share their mental stability with anyone, and they used to get burned inside themselves with their problems, and they never used to share. So they people finally either end up from their life, or they used to take some kind of unwanted step because they don't know, they're not aware that they are not aware of various kinds of institutions and doctors, psychiatrists, which can provide lot of help to them to rescue them from their mental health problems. So the second current challenge is the lack of awareness and stigma. And the third current challenge which this area is facing is the urban-rural disparity, which shows that mental health services are concentrated in cities. We don't have such kind of organizations which deal with the help of treating mental health problems of the people. And they have also highlighted some government initiatives. Government has made some kind of initiative, but yet it is not implied in our country. First is the government initiatives which has taken is the National Mental Health Program and Tele-Manas, which expands mental health support, and yet people are not aware of such kind of government initiatives. So the second one is the Mental Health Care Act 2017, which ensures legal rights to mental health treatment. And the third one is the Ayushman Bharat Health and Wellness Centers, also known as ABHWC, which integrates mental health care into primary health services. And after this, the researcher have suggested some kind of future roadmap also, in which work can be done for its improvement. First is the training of more mental health professionals and expand telemedicines they have told about. And second one is that they have told about how to integrate mental health education in schools for early intervention. And they have also focused on the increased budget allocation for mental health. We have, our government makes various kinds of budgets for various kinds of plans, but no budget allocation have yet been made in the history for mental health programs. And the second future roadmap that the researcher has given is the strengthen community-based mental health initiatives to reach rural areas. Now lastly, I would like to conclude that this paper provides a clear roadmap for mental health reform in India, and by 2047 a strong mental health care system will be a key to a healthier, more resilient nation if work has been done. If work is going to be done, not has been done, if work is going to be done in the future in these areas. Now lastly, I would like to congratulate Dr. Hima Bindu for this impactful research, and I look forward to an engaging discussion next. Thank you.
Myself Kumar. I am presenting my paper on the topic of advantages and disadvantages of e-pharmacy in India. The e-pharmacy in India nowadays have a great impact on the public healthcare system, and from some previous years the advancement of e-pharmacies are very growing. E-pharmacies has the different advantages, like they provide the medications to the customer at their doorsteps. Customers has no need to go and visit the local pharmacies. Second, the customer gets the wide range of their medications the customers can search different brands for their medications, and customer can order the economic products as per their requirements. Other than these advantages, customer gets different types of offers and discounts on their products. Along with all these benefits or advantages, there are some disadvantages also of e-pharmacies. Like in rural areas, there are a lot of population in India which are not aware about the usage of internet, usage of websites and applications. They don't aware about the payment mode on internet. The e-pharmacies sometimes may not provide the expert consultation to their customers. The customers and the public cannot search the right or legal platform to brought their products, and it is more critical in case of medications. Then we use medications when we feel some sickness, and we take medicines to get health benefits. And in this type of cases, agar we get some misbranded products, then it is life-threatening, maybe life-threatening to the customers. And there are no strict rules and regulations about the e-pharmacies to sell the medicines in India, like the other European countries. So there are lots of challenges also to customers and the companies to run the e-pharmacies in India at now present. Thank you.